What do Vincent van Gogh, Sylvia Plath, and Ludwig van Beethoven have in common? Besides their extraordinary contributions to art, literature, and music, they all faced significant mental health challenges. This brings us to a fascinating question. Is there a fine line between creativity and madness? To explore this, let's look at the brain. Creativity and mental illness often involve the brain's default mode network, responsible for imagination, self-reflection, daydreaming, and mind-wandering. Creative people show more activity in this network, which helps them generate new ideas. But how does this connect to mental health? Studies show that highly creative people have better connections between the default mode network and the executive control network. This allows them to come up with and refine ideas more easily, but it also makes them more susceptible to mental health issues. Creative minds often find fascination in the ordinary, diving deep into everyday details that others might overlook. Their talent for seeing beyond the obvious sets them apart, leading to advances in science, art, and many other fields. However, working at the cutting edge often brings psychic pain, loneliness, depression, anxiety, and sometimes leads to the use of substances to ease this pain. Some creative individuals also struggle with insomnia. Their brains become highly active at night, with ideas flourishing and excitement preventing them from sleeping. This lack of sleep can contribute to feelings of depression. Throughout history, people have often confused madness with genius. In ancient Greece, madness was sometimes seen as a gift from the gods, as Aristotle observed that those eminent in philosophy, politics, poetry, and the arts often had tendencies toward melancholia. Plato suggested that madness, provided it comes as the gift of heaven, is the channel by which we receive the greatest blessings. Today, we understand mental illness as a medical condition that needs treatment. It's important to remember that not all creative people have mental illnesses, and not all people with mental illnesses are highly creative. Let's delve into the lives of some historical figures who were mistaken for being mad, yet were brilliant geniuses. Vincent van Gogh created masterpieces while battling severe mental illness. His vivid colors and emotional intensity offer a window into his troubled yet profoundly creative mind. Sylvia Plath's poetry and her novel, The Bell Jar, reflect her inner turmoil and extraordinary literary talent. Beethoven, despite his hearing loss and rumored bipolar disorder, composed some of the most beautiful and complex music ever written. These individuals were often misunderstood and misdiagnosed, their genius overshadowed by their mental struggles. Today, we can better appreciate their contributions by understanding the complexities of their mental health. So how can we distinguish between genius and mental illness? The key is balance. Many modern creatives use their art as a therapeutic outlet. Author J.K. Rowling has spoken about her struggles with depression and how writing Harry Potter was both an escape and a form of healing. David Bowie channeled his struggles into groundbreaking music, while Yayoi Kusama's vibrant art reflects her experiences with hallucinations and obsessive thoughts. They exemplify how creativity can thrive alongside mental health management. Scientifically, positive environments and self-care practices can enhance brain function and mental health. Supportive relationships and creative outlets stimulate the brain's reward centers, while mindfulness and therapy help regulate emotional responses, reducing the risk of mental health issues.